So I think in the program, you'll see that Renae has a great deal of expertise. She lives over in the Pittsburgh area. And she asked if she could just give us an update on some resources that are available that we may or may not be aware of, but that is really important from a patient engagement standpoint. Renae.
Thank you, Chris. So thank you for, I am very appreciative that Chris was able to squeeze me in here for 15 minutes. And I've attended the Pittsburgh session last year, so I met some of you then, and then I had seen her announcement about this program. And so I really thought I could share some things from the National Library of Medicine, National Institutes of Health that might be helpful for patient engagement. And before I dive right in here, okay, thanks. Before I dive right in, I just wanted to give a little background about who I am, who the National Network of Libraries of Medicine is, and how we all fit in under the National Library of Medicine, National Institutes of Health umbrella. So, NNLM is the National Network of Libraries of Medicine. We were established in 1965 under the Regional Medical Library Program. So some of you might be familiar with your local regional medical library. We work under 5-year contracts with the National Library of Medicine, National Institutes of Health. And so our whole overarching goal and the whole mission is to provide reliable health information to health professionals and to the general public so they can make informed decisions about their health. And we do this through a variety of things. We do training for health professionals, training for consumers, and funding opportunities. But it's all about promoting the resources of the National Library of Medicine to health professionals and to the general public. So these are the 8 regional offices. I'm with the National Network of Library Medicine in the Middle Atlantic region, which is Pennsylvania, New York, New Jersey, and Delaware. I met one of my colleagues here today, PJ. If you want to raise your hand, PJ, he is with the Southeast Atlantic region. So, but again, we're working under 5-year contracts with the National Library of Medicine and the National Institutes for Health. If you don't know, NLM is a division of NIH. We're not a commercial vendor, so all these resources that are being produced by the National Library of Medicine are your government tax dollars at work, so they are free resources, and they're reliable health information resources. I just wanted to do a little differentiation between terms. I'm sure all of you are familiar with Medline. Yes? Okay, Medline or PubMed, that is geared toward the health professional. MedlinePlus, is anybody familiar with MedlinePlus? And I was happy that John just mentioned the key HIE had MedlinePlus in it, so that is wonderful to see. MedlinePlus is actually the consumer-friendly version of Medline, so it's directing consumers to reliable health-related information. And then MedlinePlus Connect, which I'm going to show you today, is the application that links right from the electronic health record or the patient portal into MedlinePlus, the consumer health information resource. So MedlinePlus, as I said, is the National Institutes of Health consumer health resource. This is just a quote from Dr. Donald Lindbergh, the director of the National Library of Medicine, about MedlinePlus. But it is created and maintained by the National Library of Medicine. MedlinePlus has over 900 health topics. These are both in English and Spanish. There are other languages in MedlinePlus, but it's almost 100% relationship in English and in Spanish. It's reviewed twice a year. There are new links added daily, and the links that are added are all vetted by folks at NIH and NLM, so it's reliable. They link mostly to things produced by NLM and NIH and other government resources, but they're vetting all the resources that it's linking to. Most of the summaries are in 5th to 8th grade reading level. and it always tells when the pages were updated. So I just flashed up at the bottom. That's just a screenshot from one of the topic pages, but you'll see it says date the last topic was reviewed and when the last resource was updated. NLM does license the ADAM product. So if you're familiar with ADAM, it is a medical encyclopedia, a medical dictionary. So it's updated monthly, and it's accessed right through MedlinePlus. The information on prescriptions and drugs is coming from the American Society of Health System Pharmacists. And again, that's updated monthly. There's also interactive tutorials that come from the Patient Education Institute. And these are written at a 5th grade or 6th grade reading level. And when we're in MedlinePlus, what you'll see, interactive tutorial in the pink there, that's how you know that you're into one of those videos. They also have an easy-to-read section. As I said, the summaries are written in 5th to 8th grade reading level. They do link out to other resources that are a little higher reading level sometimes, but they also have a special easy-to-read section that is written at a 5th grade level. There are anatomy and surgery videos, as I said, nearly 50 different languages. And then here's the link to MedlinePlus if you want to explore it. But Chris has agreed to open it up for me, and we'll do just a quick little shot of MedlinePlus so you can see the richness of this resource. And then I'll show you how Connect actually links from the health record. Thanks, Chris. Okay, so this is the main page of MedlinePlus, and excuse me, you'll see, if you can see where my cursor's at, this link will take you right into those 900 plus health topics. The second tab is the drugs and supplements tab, and then the video and cool tools. And I encourage you, please go on this resource and play around. As I said, it's free. But I'm just going to choose a health topic on COPD so you can see some of the resources that are available. All of the MedlinePlus health topics are broken into an initial summary that, as I said, was written in the 5th to 8th grade reading level. You can sign up for updates, so anytime a new resource or link is added into MedlinePlus on COPD, you can get an email alert. And then it starts with 3 or 4 just brief overviews to get you started. You'll see here's an interactive tutorial. As I said, those are from the Patient Education Institute, and they are at the 5th to 6th grade reading level. I won't start it, but you can see they can watch it, it's self-playing, or they can just print out the text summary. And then every health topic is broken into these 6 categories where they can get the basic overviews, treatments, prevention, things like that. This is the multimedia section to see videos. There's games. There's interactive things for children. And then quickly on the right, it points to the medical encyclopedia. As I said, this is coming from the ADAM Medical Encyclopedia, which is a licensed resource paid for by the National Library of Medicine. It takes to related health topics. And then here are the languages that you can get COPD information in. Yes? Yes. Yes, you want to link something from your hospital public website to MedlinePlus? Yes. Yes, you can. And there's... Exactly. And I can get you the information. You can also put a search box right on your webpage that says search MedlinePlus, and they can type in the topic and it takes you right into here. Great question. Okay. Thank you. Okay, so we already went through the MedlinePlus health topics, but again, these were the basic 6 categories that each health topic contains. As I said, it's coming from reliable, vetted resources. Sorry, I'm walking away from my clicker. Such as these ones I'm flashing up here. There is also a section for research articles, so it does a search in PubMed on every health topic, and so that's found under the journal articles and the research. So both health professionals and patients can access those research articles. Again, the medical encyclopedia and the patient handouts are coming from Adam, and then over 50 different languages. So we already did the demo. So now let's talk about Connect. So what Connect is doing, as I said, is the application that's linking from the patient portal or from the electronic health record right into the richness of MedlinePlus.gov. And how it does this is it does targeted specific information. So it's working off of the ICD-9 codes for now. It's a priority to get the ICD-10 codes whenever that becomes a national standard. Excuse me. It also works off SNOMED codes. Yes? The question? Oh, okay. When it becomes a national standard. And yeah. It also works off the RX-CUI codes for medications and the LOINC codes for lab tests. And it works under the HL7 standard. So this is just a schematic. The codes go from the EHR system into MedlinePlus Connect. MedlinePlus Connect then returns that target-specific information back to the electronic health record system, which then can go either to the clinical portal or to the patient portal. And MedlinePlus Connect comes in both a web service and a web application. The web application takes you right into that MedlinePlus page, for instance, for COPD, and I'll show you an example. The service takes you to the XML codes, so you can be very customizable with what you want to display because you get the XML information. And I'll just quickly, sorry, Chris, click on the demo so you can see, since I already showed you what MedlinePlus.gov looked like. Perfect. Now, this is an example of how Connect works. And the brochure I passed around, the links are all in there. If you didn't get one, let me know. I can certainly send you one. But you can go in here and play with any code you want. You can put your own ICD-9 code in so you can see what kind of information you're going to get back. I'm just going to go ahead and click on ICD-9 code 496. And this is exactly what you would see within the patient portal or the electronic health record. And if you remember, this looks exactly what we had showed when we typed in COPD when we were in MedlinePlus.gov. So Connect returned that information, and now it's displaying the MedlinePlus.gov information. It always starts with just a brief overview to give the patient or the clinician a brief overview. But if they click on the more, it takes them into that full MedlinePlus.gov information. So it takes them right into it. And then I'll just do an example here with a medication code. So it took us into fexofenadine. And if you click on that, again, this is coming from the American Health System pharmacist information. It takes them into information on that particular drug. Whoops, sorry, that was open from before. And one final thing, if you want to see an example of the lab test code, that happened to be for 17-OH progesterone, and you can get into specific information on that particular lab test. And as you'll see on the right, then it will then take you from the lab test information into topics on adrenal gland diseases. So from that electronic health record, the patient can get into a wealth of information, or the clinician if you decide to put it on the clinical side. Thank you. Thanks. Whoop. Okay, so why MedlinePlus Connect? We are actually promoting MedlinePlus Connect as a national initiative. So as a national network of libraries in medicine, the 8 regions that I showed you, we got together with the folks at the National Library of Medicine and decided that we really should be promoting this across the nation. So us as regional medical libraries have formed a MedlinePlus Connect task force, and we are all in each region doing things very similar to what I'm doing. It's just reaching out and educating people on MedlinePlus Connect. And we're here to do more consultations and training. It's free. It's tax dollars at work. It did win the HHS Innovations Award back in 2011. And it does satisfy one of the core requirements for CMS for that patient-specific education. I do have a link to an article of interest if you're interested. This was a hospital library that implemented Connect, and then they had a tablet program where they went around and trained their patients how to access their patient information using iPads. And these are just a few healthcare organizations and vendors that are using Connect. Since it's free and there's no registration for it, the National Library of Medicine and NIH does not make people self-report if they are using it. So it's by no means a comprehensive list. It's just a list of people who they do know are using it. And where's John? Is John in here from Geisinger? There. I don't know if you know, but that Geisinger is implementing it into the MyChart. Yeah, so I'm so happy to hear you're using it in Keyhigh too. But yeah, I've been working with Susan Robinshaw at Geisinger in the Health Sciences Library, and we've done a few presentations with the patient committee. So they moved it up to implement into MyChart. So the Institute for Family Health was really the pioneer behind MedlinePlus Connect. They actually worked with NLM and NIH to develop the product. They are a community health center in New York, several community health centers in New York. And they've done some testing, and what they've found is when they're getting people into their patient portal and they link out into MedlinePlus, they're loving MedlinePlus. So they might have linked out to look at something on diabetes, but then once they get into medlineplus.gov, then they say, oh, well, you know, my son has this or my grandma has this. And so their patients are leaving the patient portal and just really using medlineplus.gov to find out information on not just their conditions, but those of their relatives. And just finally, it's very easy to implement. NLM does work with the vendors, so if you have a particular vendor and you're not sure if they have it hooked up to work with MedlinePlus Connect, they will help the vendor get that implemented. And if you have any questions or you want me to hook you up with NLM, just let me know. Okay, and that is it. I'll take questions.